Breaking news in the world of Medicare. Hi, my name is Sarah, and I'm here today with iHealthBrokers to give you the latest scoop on Medicare. So as you may know, we are currently in the annual enrollment period for Medicare Part C, also known as Medicare Advantage, and Medicare Part D, which is your prescription drug coverage. Now, as a reminder, this annual enrollment period is every year at the same time from October 15th to December 7th. During this time, you can join a plan, or drop a plan, or switch a plan, which is what we want to talk about today. So the great news is that the premiums for Medicare Part C and Medicare Part D are at historic lows. In fact, when you compare them to 2017, Medicare Part C premiums are down 34%. That's a major savings. And of course, Medicare Part D monthly premiums are down quite a bit as well. Additionally, there are more plans available than ever before. So we want to encourage you at this time to reevaluate your plan because it's very likely that there is a better, newer, and possibly less expensive plan available to you. Now you can check out all of your options on Medicare.gov, that's Medicare.gov, but also feel free to give us a call here at iHealthBrokers at 888-410-0344. We are licensed in all 50 states with over 200 carriers, and there is no charge for our services. Now, if you'd like to learn more about Medicare Part C and Medicare Part D, you can check out the videos at the end of this video. Additionally, there's other great and breaking news that we want to discuss, and that pertains to Original Medicare, also known as Medicare Part A, your hospital insurance, and Medicare Part B, your outpatient insurance. So every year, there do tend to be increases in prices to accommodate for inflation and rising healthcare costs. This year, those rates, your monthly premiums, your coinsurance, your deductibles, and copays are going to hold more or less pretty steady. In fact, your monthly premium for Medicare Part B is only going to go up a couple of dollars, and that's great news for those amongst us that are living on a fixed income or just those that watch their cash flow. So if you have any more questions, you can reach us here at iHealthBrokers at 888-410-0344. Yes, there is no charge for our services whatsoever. We are here to help. And if there are any other videos you'd like to see, let us know in the comments or ask us a question and we'll do our best to help. Thank you so much for watching. Have a great day. Bye-bye.
Hang on, don't leave just yet. Stay tuned to this video for our video all about Medicare Part D. We've updated some of the facts and figures to reflect those of 2021. Also make sure to subscribe and of course check out our Medicare playlist. That way you stay informed because staying informed is the best way to save money.
Medicare Part D covers prescription drugs not covered by Medicare Part A or Part B. You cannot get prescription drug coverage through a Medicare supplement plan, also known as a Medigap plan. However, you can get it with a Medicare Advantage plan, and we'll talk about that in another video. Your open enrollment period is the same as your open enrollment period for Medicare Parts A and B. So that would be the 3 months before you turn 65, the month of your 65th birthday, and of course those 3 months after. Now this same period of time is applicable if you're receiving Medicare through disability. You may also be eligible for a special enrollment period. Let's say you defer Medicare because you're still working. Well, you may be eligible for a special enrollment period. However, we encourage you to contact a broker in advance and make sure, because that list of qualifying events is long, but you want to make sure that you are in fact qualified. Otherwise, you could end up paying a late penalty. And of course, you always have the option to enroll during the annual enrollment period, and that's the same time every year. It's October 15th through December 7th. But like I said, if you enroll outside your open enrollment period or a special enrollment period, if you're qualified, you may be subject to a late penalty, and nobody wants that. Medicare Part D is offered by private carriers, but it is regulated by Medicare. Now, all Medicare Part D plans must meet these federal guidelines. Carriers can compete to offer better benefits, but they must meet the guidelines no matter what. And there are 4 stages to Medicare Part D. Stage 1, the deductible. Stage 2, the initial coverage period. Stage 3, the coverage gap, also known as the donut hole. And Stage 4, catastrophic coverage. Every year, Medicare sets a max deductible that any carrier can charge. For For 2020, this max deductible is $435.
Hey folks, let's just freeze here for a second. I just want to say that in 2021, the max deductible will be $445, so that's a $10 increase from 2020.
This max deductible does tend to increase on a yearly basis to accommodate for inflation and rising healthcare costs. However, for 2020, the max is $435. Now, a carrier can choose to waive it or lower the amount to compete for your business. While you're in the deductible period, all prescription drug costs are out of pocket, which means that if your drug costs $75, you pay $75, but you only do so until you meet that deductible. At that point, you move on to stage 2, the initial coverage period. Once you have met your deductible, you move on to stage 2, which is the initial coverage period. In stage 2, you'll be responsible for copays. The amount of the copay is dependent upon the tier of the medication. You've probably heard of tiers in relation to Medicare Part D. And there are 5 tiers. Tier 1 is preferred generic, Tier 2 is non-preferred generic, Tier 3 is preferred brand, Tier 4 is non-preferred brand, and Tier 5 is specialty medication. Now, stage 2, like stage 1, is capped. This year, in 2020, it's capped at $4,020.
All right, let's pause again real quick. In 2021, the limit for stage 2 is going to be $4,130.
So Medicare keeps track of how much you spend out of pocket, contributing to those copays, and how much Medicare is spending. Once you've reached that cap, $4,020, you move on to stage 3, which is the coverage gap, also known as the donut hole. Stage 3 is the coverage gap, also known as the donut hole. This is where people tend to get pretty confused. Instead of paying a copay dependent upon the tier drug, like in stage 2, you'll now be responsible for a percentage of the cost of the drug itself. So for a name brand, you'll be responsible for up to 25% of the cost of the drug. For a generic, the percentage is a little bit higher, but because the cost is so much less, you usually end up paying less anyway. Like I said, people tend to get pretty confused and pretty upset because one month they're paying $25 and all of a sudden it jumps up to $75. If this happens, give your broker a call. You're most likely in the donut hole, but if you're not, they can help walk you through it and handle it for you. There is a cap for stage 3, just like stage 1 and 2, and in 2020, that cap is $6,350.
Okay, last major change. In 2021, the cap will be $6,550.
Once you hit that cap, you'll move on to stage 4, which is catastrophic coverage. Stage 4 is the catastrophic coverage period. During this time, you are only responsible for up to 5% of a drug's cost. So it's like stage 3, but it's 5% as opposed to 25%. Now, the reason that this percentage is so much lower is to help limit your out-of-pocket costs. They don't want you paying an exorbitant amount yearly on your prescription drug costs. Now, obviously, this is the most economically friendly, but we hope you don't have to get to this stage. There are many different carriers for Medicare Part D, and as such, there are many different advantages and many different prices. One plan may boast lower deductibles but have higher copays. Another plan may be more expensive but have lower copays that could save you in the long run. So for this reason, we really do recommend contacting a broker who's there to serve your needs. Should you need any help, you can reach us at iHealthBrokers at 888-410-0344. Again, that's 888-410-0344. I hope today's video has been helpful and helped you to understand Medicare Part D just a little bit better. If you liked this video, make sure to click like and subscribe below. Also, if there are any other videos you'd like to see, let us know in the comments or just say hi. We'd love to hear from you. Thank you so much and have a great day.